Hello everyone. Today we are going to be studying about tetanus, the second topic in our CNS series. So, what is tetanus? The tetanus is manifested by skeletal muscle spasm and autonomic nervous system disturbances. Okay. So, what is the causative agent of tetanus? It is Clostridium tetani. Clostridium tetani. Okay. The main things how you can identify that the patient has tetanus is by skeletal muscle spasms, okay, and nervous system disturbances, okay. Now what is the mode of transmission? Mode of transmission, so it is by any injuries like in superficial abrasions or in road accidents. Surgery can also be a cause when there is aseptic measures not taken properly, which can lead to tetanus. Okay, it can occur in neonates when there is unhygienic or abnormal or abortions. Okay, so unhygienic deliveries or abortions. Now, what is the clinical manifestations which you will see? So the clinical manifestations which you will see, so first symptom is going to be lockjaw. This is the first symptom which you will see in patients when they come into your clinics. What is the cause of lockjaw? Sorry, it's not low jaw, it's lockjaw. What is the cause of lockjaw? Increase in the masseter tone, which leads to lockjaw. After lockjaw, the other symptoms which are seen are muscle pain, it will be muscle pain, then difficulty in swallowing, and stiffness. Okay, I'll just show you a figure. So this is a figure of lockjaw. You can see that the patient is not able to move its jaw. Now as the disease progresses, there will be painful spasms. So as disease progresses, there will be painful spasms. Okay, painful spasms. Then there will be an impairment of hands and feet. Another is autonomic dysfunction. This is seen in second week of tetanus. It causes increase BP, tachycardia. Okay, now we're going to see the complications. The first is going to be Rhizus sardonicus. So what is Rhizus sardonicus? It is abnormal sustained spasm of the facial muscles. Abnormal sustained spasm of facial muscles. And the second is opisthotonus position. The word is a little bit challenging, but it's an important complication which is seen. Opisthotonus position. So what is opisthotonus position? So when there is spastic contraction of the extensor muscles, it causes like a curve shape of the back. See, so this is opisthotonus position. Okay. Another complication which can be seen is obstruction of the respiratory pathway. Okay, so which are the three complications? It is Rhizus sardonicus, opisthotonus position, and obstruction of the respiratory pathway. Now, what is the lab diagnosis which is to be done? Remember, lab diagnosis is very important. Laboratory diagnosis in case of tetanus, we should always start with the treatment first and then conduct lab diagnosis, because treatment is a very important part. Okay, you can confirm it by lab diagnosis later on. So now, which specimens will you collect? So you can collect tissue bits of necrotic depth of the wound, these are the most reliable. You can also sometimes take wound swabs, but this is the most preferred specimen. You can conduct gram staining. What will the gram stain show us? It will show us gram positive bacilli. Okay, how is going to be the shape of this shape? So this, then let's take some pink. Okay, there are going to be many of these. Okay, and they're going like this. Suppose this is your slide. You're going to see many of these. Okay, so this is how they are going to be seen. But remember that microscopy alone is not reliable. Okay, because they cannot differentiate between Clostridium tetani and Clostridium tetanomorphum or Clostridium sphenoides. So you should not always depend on gram staining. Another thing which can be done is culture. So culture is more reliable than microscopy. Culture is more reliable than microscopy. Which medium are going to take? So Robertson cooked meat. Robertson cooked meat broth. Why are you going to take this? Because Clostridium tetani is proteolytic. Okay, proteolytic, which will cause the meat to turn black. Okay, another method is by blood agar and polymyxin B. Okay, so culture mediums. Okay, now you're going to be performing a toxigenicity test, which is another method. Toxigenicity test. So tetanus is a toxic mediated. Okay, is a toxin mediated. Which toxin is present? Tetanospasmin is present. It is a neurotoxin which causes the disease. Okay, how does it act? The tetanus toxin, the toxin will bind to toxin will bind to the receptors, okay, at the motor nerve terminals on motor nerve terminal, which results in internalization. Once these enter, these get transported to the GABA, transported to GABA, okay, and they produce an inhibitory neuron terminal. So this prevents the presynaptic release of inhibitory neurotransmitters glycine and GABA, which will cause muscle spasms. Okay. Now we're going to be seeing the treatment of tetanus, which is important. Okay. Treatment. There is a passive immunization. Okay. So passive immunization is the treatment of choice. Passive immunization treatment of choice. Remember, two preparations are available, which is human tetanus immunoglobulins, and the second is anti-tetanus serum. Anti-tetanus serum. Another is passive immunization, or it can be combined immunization. Combined immunization. It is the ideal dose for first dose. It is ideal immunized for the first dose. Okay, it is administered in the form of ATS or NTG. Okay, so these two are the main treatments which are available. It will be passive or combined. Combined is in the form of DPT vaccines. Okay, DPT vaccine, or it can be tetanus toxoid and adult diphtheria toxoid. So TD vaccines. It can be pentavalent. So what is pentavalent? It includes DPT, it includes Hep B, Hep B, and it includes HIV. Okay. So if you are injured, so there should be wound should be cleaned properly, and then immunization is recommended. So I'm going to be showing you a table which shows the recommended prevention of tetanus. It's given in the book, just see it. So I just have taken this table from the textbook. So the recommendation of prevention of tetanus. Okay, the complete course of vaccination should be taken within 5 years. So no tetanus prone wound. If there is a tetanus within 5 to 10 years of age, then one dose is required. If taken more than 10 years back, one dose of tetanus plus HTID is required. Okay. What is HTIG? It's human tetanus immunoglobulins. Okay. And if it's unknown incomplete immunization, so the tetanus complete dose. Okay. So just see this table from a book, and it's a easy and short video on tetanus. Please like, share, and subscribe to my channel for further content. Thank you and have a nice day.